And let me just set a little timer here. Great. Welcome everybody. Dr. Natalie Gentile here with the Rebels and Wellness interview series. And I am so honored to have Dr. Yami here. I have been following your work since I was a resident in training at Mayo Clinic and first started learning about a plant-based lifestyle. So thank you for being here.
Well, thank you so much for inviting me. It's such a pleasure.
So I have your book here, The Parent's Guide to Intuitive Eating. I refer to it for my patients a lot. Whole families. As a family doc, I see parents and littles. Can you tell us a little bit about how this came about?
Yeah, it's an interesting story, actually. So I have been plant-based myself for over 11 years. I've raised my children this way since they were 6 years old and 18 months old. And kind of we were talking before we started recording that you were interested in studying obesity, and I got really into that too. Like in residency myself, before I graduated residency, I was all about, okay, how are we going to reverse this problem? And and mostly for me it was because it's been a personal journey since I started dieting when I was 9 years old, and yo-yo dieted and had a lot of issues with my body image. And so I was very focused on that because I felt that I had suffered so much because of my body size, and I wanted to prevent that in my children and my patients. The problem was that the approach I took, I don't think was going to lead to the solution that I wanted. It was probably going to, in part, perpetuate the problem because we're so stuck in this paradigm of thinness, and certain body sizes, and also diet culture. So I learned about plant-based nutrition. I felt like it was a really great solution for me because it allowed me to step away from dieting. Although I probably for several years was still kind of in that mindset of body size and all of that, even though I had stopped weighing myself and I technically had stopped dieting. I really wanted to write a book that was about plant-based nutrition for children initially. But as I started going through my evolution and my journey, I realized, this is important information, and it's very simple and it's pretty easy to teach, I think. But I don't think it's the foundational information that I really feel that parents need to have, whether they're going to raise their children plant-based or not. Obviously, we want kids to eat lots of whole plant foods for health, and there's undeniable evidence to support that. But what we really need to learn as parents, as physicians, as healthcare providers, is how to feed kids and how to approach feeding kids in a way that supports them for their health and their well-being, but also takes a step away from diet culture and body size. So I had started writing this book that was mostly about, plant-based nutrition in kids. And I was like, this doesn't feel right. I put it down and I realized, okay, I want to write more about intuitive eating and how to feed kids. And within a couple of weeks, I got an email from a publisher inviting me to write that very book, believe it or not. So it was very aligned. It was very meant to be. And so that's how this book came about. So I definitely talk about plant-based nutrition. And I also talk about lifestyle medicine because it's not just about what we eat. You know this, right? It's also about making sure we're getting adequate sleep and moving our bodies and, staying connected with one another, avoiding risky substances, decreasing stress, all of those kinds of things. So I definitely address how those lifestyle factors affect children, their eating, their relationship with their bodies, and all of that. But first and foremost, it talks about how we can use these principles of intuitive eating and apply them to our children, and how we can learn to feed our children in a way that decreases our stress levels, but also helps support them in a healthy eating journey.
At the time of us filming this, I have a 3 and a 5-year-old. Okay. And I joked the other day, not even joking, the most frustrating and stressful part of my my week is feeding my 5-year-old and doing prior authorizations for insurance companies.
Oh man.
Time one is worse than the other. And I'm a parent who works on intuitive eating and leads a plant-based lifestyle for my kids, and have had an eating disorder, and I still find it incredibly challenging.
Yeah. It's difficult. And I will say that in the book, I talk about how I'm not perfect. And there's still times when I have to take a deep breath and, whew, it's going to be okay. Go to the next room or whatever it is. And also, you bringing up having an eating disorder, having disordered eating, having issues with our own bodies, feeding our family is triggering. It's very triggering. And sometimes even just watching them eat is triggering,
Oh my gosh.
So we have to kind of almost like re-explore our own relationship with food in our bodies when we feed our children. And that's why it's so important not to be perfectionistic about this, to give yourself so much grace as a parent, and to know that really at the end of the day, you're doing a great job and everything is going to be okay. Because in this day and age, I feel that parents are so afraid to make mistakes and they feel like they're already doing everything wrong. And they're so afraid that they're going to mess things up. But really, kids do great. They're very resilient and they have this natural intelligence about the way that they feed themselves. All we need to do is provide the health promoting foods and then let the rest take care of itself.
Well, when you said that they're very resilient, and I hear intuitive eating for littles is a very different thing than intuitive eating for adults, because there seems to be a transition into from little into tweens into adulthood where we kind of lose our intuition or our trust in our intuition.
Actually, it's as early as 5 years old. So the studies show that we kind of teach it out of children by around 5 or 6 years old because we don't trust them. And we keep telling them, no, you need to eat more. You're not eating enough. Like we're telling them you're not eating enough, And so that's very common. 85% of parents try to get their children to eat more, believe it or not. And so we're telling them, you can't trust your body. You need to listen to me. I know better. And you need to eat this instead of that. And you can't have this until you eat that. And these messages that we're giving them is basically like you need an external method to tell you when to eat.
Oh my
And, just like I said before, I am not trying to shame or blame parents. This is very common. And I'm a parent too. So believe me, I've done this and I still sometimes slip. So I'm not perfect. But if we go to the foundational principle that children are born intuitive eaters, they know when to eat, they know when to stop, then if we continue to trust that process, we can reinforce that instead of teaching them out of it. And one of the best methods to do that is the division of responsibilities. So the division of responsibilities basically is that the child and the parent both have autonomous roles. The parent decides what, when, and where. So what I'm going to feed my children, when and where, hopefully sitting down somewhere without distractions, with a flexible structure. So breakfast, lunch, and dinner, 2 or 3 snacks throughout the day. But then after the parent does that role, their job is over. They put the food on the table or they put the food in front of the child. And then it's now the child's turn to take over and decide if and how much they're going to eat. And so that's where it gets really hard for the parents not to jump in and take over and be like, no, you're definitely not eating enough. I can't believe you're not touching your salad, those kinds of things. But we have to resist. We have to bite the tongue. We got to, go to the kitchen and do something, whatever you need to do to just kind of refrain from interfering, whether it's with words or whether it's with our facial expressions. Because I'm telling you, moms are the best at giving the face of like, you're not doing what I think you should be doing, so.
Yes. It's so funny. I was laughing this morning, like literally the conversation was, can you just eat the 2 grapes? Like just try 2 grapes. And I would not give it up. I would not let that go. And I thought of you. I'm like, how timely we're going to have this conversation.
It's an intervention, Natalie.
Oh my God. And I think a lot about parenting is like, what hill are you willing to die on? Because there are so many hills. And so can you give us a little bit of some of your, a tip around that for those of us parents when it comes to the hill of eating?
Yeah. Well, I think And in the book, I summarize it into 5 pillars of healthy eating because I didn't know what else to call it. So these are pretty much like the 5 things, like guidelines. And nothing is a set rule for anybody, right? Because each family has to decide what works for them, for their lifestyles, and for the way that they do things. But the first one is to honor hunger and satiety. That's the first thing. And like I said, most parents are actually trying to make their kids eat more. There's definitely going to be a percentage of parents that are trying to restrict food from their child because they're concerned about body size or something like that. Both of those we don't want to do. So we want to honor that hunger and satiety by understanding that children, for the most part, are very intuitive. There's always going to be exceptions to this rule, and I discuss it in my book. So children that have genetic disorders or pervasive developmental disorders that we cannot trust their intake, but some of those children are going to have G tubes and things like that. So you'll know if your child is not in this category. But for a typically developing child, we can generally trust their hunger and their satiety. So that's the first rule. The second rule is to emphasize whole plant foods. So fruits, vegetables, whole grains, beans, nuts, and seeds. And, each stage has appropriate levels of how you're going to present those foods. But in general, try to fill your home and your lives with these whole plant foods. It doesn't have to be exclusively that way, but right now we're very far from it. So don't stress out about having to go 100%. Just get more of it in your life. That's going to be a really important step. And like I said, it's not about perfectionism. It's about little steps towards that. The third principle is going to be creating a positive environment. And what I mean by this is, in order to support these habits, we have to align our lives to them. So I love talking about vision boards and how vision boards are so important in helping us get to our goals and dreams. Well, you want to make your world your vision board. So if you want to eat more fruits and vegetables, you actually have to buy fruits and vegetables and put them in your fridge and on your counters and, in your home. And then you see those. And when you see those things, you're more likely to eat them. But this also applies to how we talk about ourselves and other people, whether we're talking about body size or whether we're talking about losing weight or getting into a summer body or whatever. These conversations are so normal and part of our lives that you may not even realize that you're teaching your child that body size is a very important factor in worth. Okay. So, and it also, just if you're being mean to yourself, which is very typical for women, because we think that if we say things about ourselves, it's going to whip us into shape. And then we're finally going to stick to whatever diet. So just start paying attention to the words that you say about yourselves, about others, the magazines you have, the movies you watch, those kinds of things, and fill your environment instead with empowering messages and messages that support taking care of our bodies and loving our bodies and nourishing and fueling our bodies so that we can actually enjoy our lives and be happy and have well-being and longevity. So shifting those messages in the way that you're hoping that your children are going to feel about themselves, a few years, 5, 10, 15, 20 years down the road. And then just having fun and taking it easy and enjoying the ride. I think being flexible is very important. And then along those lines is going to be what I call the 80-20 rule, which is 80% of the time, be as health promoting as possible so that you can have a 20% wiggle room. Vacation, parties, it's part of our lives. We love it. We enjoy it. We want to take part in these things. We don't want to be so strict that we can't socialize. And in the book, I talk about how each family can determine for themselves how they're going to go about some of these things. Depending on some families, they may be more strict vegans. And so there's different ways to approach these things. But in general, having some flexibility, because that way you are able to show your child how they can do it in the real world, because we live in the real world. So they're going to go off to college, they're going to go socialize with their friends, and we need to show them that we trust them in these situations to make the best decisions for themselves.
Yes, that trust is so challenging and so important. And it comes back, I think, to that also message of, wouldn't you want someone to treat you like that as an adult? Or
Absolutely.
wouldn't you treat a friend like that, trusting them and trusting their decisions? And I think we try to really paternalize, in that, using that word in the sense of we really try to hover over kids nowadays.
Exactly. Yeah. And parents are well-meaning. They're absolutely
Mhm.
well-meaning. And, I think as doctor moms, we're probably some of the worst, right? Because we know too much
Yes.
and we think about all the horrible things that could happen. And when I ask moms, what is it that you're imagining might happen to your child, if they don't eat their broccoli or whatever? And it always goes to like their brain is going to shrink. And I'm like, good news, their brain is not going to shrink. So like, but as moms, we do. And that's a good thing, right? Because we want to protect our kids and we want to make sure that they're safe. But what I try to reassure parents is that in general, kids do so well. And knowing that you're listening to this means that you're not neglecting your child. So obviously there can be some parents that really do neglect their children and bad things can happen, but you're not one of these parents. So just taking a step back, taking a deep breath, offering the food, and knowing that they're going to be fine. They're going to get the nutrients that they need to grow and develop and thrive.
Amazing. Well, and we could talk forever. I mean, your work is so, so wonderful. And I'm grateful as a parent and physician to learn from you. Where can the community learn more about you if they haven't found you already?
Well, I'm active on Instagram at the Dr. Yami, but I also have a podcast myself called Veggie Doctor Radio, and you can find that on any of your podcast players. And then my website is dryami.com. And from there, you can also find my other website, veggiefitkids.com, which has a bunch of resources listed under there. But yeah, Dr. Yami, you can find me lots of places online. And my book is called A Parent's Guide to Intuitive Eating, How to Raise Kids Who Love to Eat Healthy. It's available in paperback, an ebook, and also an audiobook that I narrate myself. But lots of parents have been requesting it at their local libraries, which is great because then lots of people get access to it. So that's something you can do, or order it from your local bookstore.
Amazing. Thank you so much for your time and for educating us in the community and doing what you do.
Absolutely. It's my pleasure and much love to all the parents out there. You're doing a fantastic job.
Yes, keep it up, team. We can do this. We'll see you next time on Rebels and Wellness.